So, Noah, my first question is, can you describe your path since you completed your residency program where I last knew you? What's been happening?
Certainly. I finished residency in 2015 and did residency at the University of Massachusetts Med School, and my clinical site was the Barry Family Health Center. I stayed on there as a family medicine hospitalist, working part-time, mostly nights, so I was doing mostly nocturnist work on our family medicine inpatient service. And I did that for about 2 years, and concurrently at the same time, I was attending Harvard Business School, working on my MBA, which I finished in 2017. And when I finished my MBA, I decided to move my clinical practice closer to Boston because I've been living in Cambridge, and I was very fortunate to find an opportunity as the system chief of the hospitalists for the Steward Healthcare System, which owns St. Elizabeth's Medical Center and a few other hospitals in Massachusetts, and now nationwide after a merger and acquisition. So I'm the system chief of the hospitalists with about 70% of my time, and with the other 30% of my time, I still work clinically as a hospitalist, mostly at St. Elizabeth's, which is our tertiary care center, as well as one of our smaller community hospitals, Neshoba Valley Medical Center, that's about an hour northwest of Boston.
Cool. And what are you doing with your MBA?
Yeah, so with that 70% of my time that's non-clinical, probably about a half of that is devoted to managing the hospitalist programs. And we have kind of a patchwork of different employers for our hospitalists. So we have some doctors who are directly employed by Steward Medical Group, which is our physicians organization, and that's at St. Elizabeth's, Neshoba, and then Kearney Hospital in Dorchester. And I directly oversee them from a financial perspective, an operational perspective, clinical quality, patient experience, personnel, all of those things. And then at our other sites that use staffing agencies to employ the hospitalists, I manage the relationships with the staffing agencies. So make sure that they're living up to our expectations in all those areas that I just mentioned. And then with the other about 35% of my time or so that is non-clinical, I work on optimizing patient length of stay kind of throughout the system, and focus on that as an operational metric. So I work on a variety of strategic and tactical initiatives to optimize length of stay.
Cool. So just as an aside, the only thing that I know about Kearney is they did have a family medicine residency program for a while. I think Deb Ehrlich was the residency director, but they closed that program a few years ago, I think. Yeah,
it was a few years now. I want to say maybe 4 years or so.
Yeah.
Yeah, it was unfortunate, certainly.
So let's go back to you. Back when you received the Emerging Leader Award, you had some goals, you had some ambitions and intentions. How does what you're doing now align with those goals and intentions? How do you see your career path as you're moving forward?
Yeah, the short answer is that it aligns very well, and I feel really extremely lucky and blessed to have a job and a career that gives me so much of what I wanted out of my work. So probably the first biggest thing that I'm able to do is continue to care for patients. And I feel really lucky to have a boss and be part of a system that values having its leaders still continue to work clinically. So I'm really glad that I'm not just able to do that, but that my boss is very supportive of it, and she's non-clinical, I should say, and she's happy that I'm able to, and really recognizes that it makes me a more effective, satisfied leader to be able to continue to care for patients. So that's probably the first thing. The second thing is, like you asked about, having an opportunity to use my MBA every day. I feel really lucky to have gotten the business education that I did, because I feel like I have frameworks to bring to bear on just about every business scenario, situation, problem that I'm confronted with, and I do so on a multiple times a day, bringing kind of the frameworks and everything that I learned to bear, and I think that's really allowed me to. I think I could have eventually gotten where I want to get, but it's allowed me to really get there at a much faster rate, which has been fantastic. And again, I feel really lucky about to have gotten the education that I did. And then the last thing is, well, I guess maybe two more things. The next one is being part of a teaching system. So the opportunity to still work with med students and residents, both in a clinical and non-clinical way. So on the wards, I still teach med students and residents. I teach a physical exam kind of seminar for Tufts medical students when they're starting their internal medicine rotations with us in the hospital at the beginning of every 3-month block. I teach a new group of med students, and then I also teach the residents when we're doing clinical work from time to time, and then I run an elective offered for UMass med students as well as Tufts med students, though I haven't had any Tufts med students take the opportunity yet, an elective on leadership and business in medicine. And I do that as either a week or 2 weeks where med students, typically in their third, some in their fourth years, can shadow me for a week essentially and just go to meetings with me, be on phone calls with me. I actually have one working with me today. She's not on this call because I kind of let her go early to try to get out of the Boston traffic and get back to Worcester before the traffic got too bad. But I feel very, very lucky to be able to share some of the things that I've learned, both clinically and non-clinically with learners. And then the last thing probably is just being able to maintain a sense of balance. I feel lucky that my boss is, she's a mom, so she, recognizes the importance of time with family, and has communicated that to me, and that's made me feel very comfortable kind of taking flex time, using flex time, and and setting my own schedule, so that I have the opportunity to take my daughter to daycare and make breakfast and things like that on a fairly regular basis. So I'm really glad to be able to do that. And they leave time open for me to take other opportunities, and supportive of me taking other opportunities, like continuing to work with the Massachusetts Academy of Family Physicians, and I'm soon actually going to be joining the board of a startup that one of my actually have someone who went to undergrad with me, a company that he's starting, and I got support from Stewart to do that. So I feel very lucky to have all those things, and then kind of in in an unanticipated way, Stewart has grown a lot very quickly. I mentioned they did a merger and an acquisition last year, so that has kind of created a built-in way for me to take progressive responsibility, which has been really nice just to kind of have that tailwind. And it's great to be part of a system that's doing well and growing.
Cool. So, Noah, what do you do? I know you completed the MBA, but what do you do now to help feed yourself, nurture yourself in terms of your leadership development?
Oh yeah, that's a good question. Well, I'd say probably the biggest and first thing is having good mentors. So I still lean on mentors and and get people's advice about things. That's another one of the great things about my boss. I have a weekly call with her, or call or meeting, and I can bounce any questions or anything like that off of her. So that's great. And certainly I've really looked to mentors throughout every kind of phase of my career and my training, from clinical mentors to non-clinical mentors, and feel very fortunate to add those people in my life. So that's probably the biggest single one. Other ways, I do a lot of reading. I've always been a very voracious reader. So I read hospitalist journals. I read family medicine journals. And whenever there are articles about leadership, I often go to those first. And I also kind of stay on top of business literature too, and really try to think about leadership in as much of an evidence-based way as I can. Kind of bringing the idea of evidence-based medicine to the non-clinical arena. I actually recently gave a talk to all the new residents and fellows who are orienting at the end of June, beginning of July, on evidence-based patient experience. And I think there are a lot of realms in healthcare where we have an opportunity to use evidence more robustly. And I think that we've done that pretty well. We started that work kind of in the 90s, and we've do it pretty well, but I think we've done it a little less well. Kind of not directly clinical arenas like patient experience, like even operations, frankly, and then leadership as well too, because there certainly are best practices in all those fields that we're not always using in healthcare. And then I try to go to conferences as well too. I've done a little less of that over the last year, just because I really wanted to focus on just this first year of getting up and running in my job as effectively as possible. So I haven't gone to conferences quite as much as I was previously. But I'm actually entering a new CME cycle at the end of this year, so I anticipate doing a lot more of that, and I'm hoping to get to the FMEC and then one of the AAFP conferences. I'm not sure which one it's going to be exactly, and then possibly maybe a hospital medicine conference. So we'll see. So that's one that I was really doing a lot of, that I look forward to getting back into. I think those are probably the biggest things I do for leadership development. And then, honestly, probably I'm a big believer that we learn by teaching, and really through the elective that I run, that I mentioned on leadership in business and medicine for med students. Teaching them. It's funny. It's very serendipitous. I had a new student today, like I mentioned, and I always start the first day talking as our leadership day. I kind of structure the week as a mini MBA, So we do a leadership day, we do a strategy day, we do a finance and operations day, marketing, that type of thing. And today was leadership day. So I feel like I learn as much by kind of teaching, those things on a regular basis, as well as hearing from medical students. They often bring experiences to that week or two with me that are really just kind of neat and unusual for me to hear about. Like I heard from one of the early students who did the elective with me. She and her husband had actually started a small business, I think just before med school, printing posters for scientific conferences. And they were doing so well that she was paying for med school with it. And I thought that was so neat to hear about someone, who kind of had a sense of entrepreneurship like that, and then to be able to balance that with med school. And then she had a young daughter to boot too, so it was pretty impressive and neat to hear about her work.
I'll say, wow. So just a comment in terms of the FMEC. We're going to have a very exciting Innovators Network meeting on the Friday, November the 9th. And as somebody who sees himself as a leader, we will be looking at we don't really have a healthcare delivery system in this country. We have a healthcare finance system. And so what would a delivery system look like, and what role would primary care, and what policies and strategies would be in place to support what I call robust primary care? And so that will be the focus of our Innovators Network this year. So if you decide to come, you really want to get there on Thursday night, so Friday morning you can jump right in on this. I guarantee you that you will get exposed to some people and ideas that would be really valuable for you.
Oh, great. Yeah, that's neat to hear.
So do you have a favorite book if you were, as a leader, if you were recommending books on leadership?
Ooh, wow. Oh, that's a tough one. That's funny because I was just talking with the medical student who's working with me today. I deliberately have them do a couple of different leadership style inventories so that they can see how differently things can be categorized, and that there's different terminology, and some of them have different numbers of leadership style categories. And I deliberately kind of try to teach them that, that there's really nothing immutable or set in stone about most of leadership, and that the kind of leadership book industry is just that, an industry that, just about all of it needs to be taken with a grain of salt. And then I try to teach them that it's the most important things are just recognizing their own kind of intrinsic leadership style and, putting some name on it, whatever that name is, so that they know kind of what they're bringing to a situation and what their biases might be because of it. And then also to second recognize the type of leadership style that a situation is trying to draw out from them, so that they can ask, one, is it compatible with my kind of leadership tendencies? And then two, is it actually the optimal style for the situation in order to come to an optimal outcome? So I wouldn't really say from a leadership book that I have a favorite. I think it's related. I think negotiation is related to leadership, and probably my favorite negotiation book is Getting to Yes. I really like that.
Yeah, that's a good one.
That's been a great framework for me in terms of effective communication and like I mentioned before, just really trying to get to an optimal outcome that's acceptable to all parties involved. Cool.
So can you describe any random events, opportunities, conversations that happened along the way. You used the term serendipity. I'm a real believer in serendipity. It happens all the time. And anything that happened along the way that stimulated you to go one way versus another way, or that stimulated your thinking about your development?
Yeah, well, how long do you have? I could probably tell you a million. I'm right there with you. To me, I kind of think there are no accidents when things come into our lives. It's just a matter of how we recognize them. But yeah, I mean, like I said, I could give you a million. Probably, a big one that relates to the conversation we're having in my career. Just to put it simply, in two words, is Stacy Potts. She was one of my preceptors in my family medicine rotation. I was in my first delivery with her, and that made me realize that I wanted to do family medicine instead of combined internal medicine pediatrics, because I would have the opportunity to do obstetrics with family medicine. Even though I'm not anymore, it made me. I mean, for one, I still loved having that opportunity in residency, and I feel so lucky to have helped bring so many children into the world. That was just amazing. But it also really showed, and she showed me that family doctors are my people, and I think that's so important for medical students to to choose a specialty, to kind of find their people, and that was that was definitely that moment for me. I wrote about it in my residency application essay. My father actually lives in Western Mass, so I was staying at his house while I was doing my family medicine rotation. And I got a page on my pager that I didn't recognize, and called the number back, and it turned out it was Stacy, and she told me, if you can get here safely, a patient that I'd been following, I think I'd seen her at least 2 prenatal visits before, that she was about to deliver, and she was a grand multip. It was her 6th baby, I think, and her first daughter, so she was so excited.
Wow.
And I drove through the night, got to Memorial, and was able to be part of her delivery, and it was a really amazing experience, and that was definitely the spark for me to go into family medicine.
Wow. Well, speaking of serendipity, after I asked you this question, I remembered that Stacy put you and I together at a dinner table in Kansas City.
Yep.
And we had a conversation. That's where I first learned about you. And after that conversation was over with, the next day I said to Stacy, you need to nominate this guy for our Emerging Leader Award. He's going to change the world. I remember that conversation.
Oh, thank you. And I was thinking meeting you was one too that I could definitely think of as an important moment. I just didn't want to give you too much of an ego there or anything.
Okay, so let me ask a question, a slightly different question. What effect did receiving the Emerging Leader Award have on your development as a leader?
Yeah, that's a great question. So I would say there were kind of tangible and intangible things. That's how I would kind of frame them in my mind. And some of the tangible things were first, and I know they're not necessarily related, but they felt related to me because at the conference, I gave the talk that I did, and then got that award, and so those two experiences will be kind of inextricably linked in my mind. And being able to give that talk was a really special opportunity for me. Like I mentioned, from the tangible perspective, just being speaking in front of that many people. At the conference, I think, it seemed like it must have been 400 to 500 people, somewhere around there.
Oh yeah, there's more than that actually.
Oh yeah, okay, great. So that was, just really, I mean, it's that's such important experience, such an important experience for a leader to get, just feeling comfortable talking in front of people. So I felt lucky, that early on in my training to get that experience, that kind of experience. So that's really from the tangible perspective, and like I said too, going to conferences for me has always been a really great way to kind of reconnect with the soul of family medicine. Especially in my current work, being a hospitalist, it's a little kind of in the minority in terms of what family doctors do, because they're, obviously most of us do outpatient primary care, and then there are relatively fewer of us who are hospitalists and do inpatient medicine. And I can feel sometimes like I'm a little disconnected, and as a result of that, and most hospitalists are also internists. They did internal medicine residency, so I can sometimes feel a little disconnected from family medicine. And it was great, a great way for me to feel really connected back to family medicine. So it had both kind of tangible and intangible impacts on me. From the importance of the opportunity, and just feeling comfortable, speaking in front of that many people, and to then getting to share my story, and and really, like I said, reconnect with the soul of family medicine.
Cool. So could you tell us a little bit about your hopes and plans for the future?
Oh, sure. Yeah. Again, how much time do you have?
I'm sitting in bumper-to-bumper traffic on a highway, so I have all the time in the world.
Yeah, there you go. So in the near term, and I kind of talked a little bit before about kind of taking progressive leadership responsibility. I want to keep doing that. And then talking about serendipity, there's an opportunity that I just kind of heard about within Steward that I'm excited about potentially pursuing, that would be a significant increase in responsibility. It's like, but it's very early on, so I can't talk too much more about it now. But I'm thinking that that's probably where I'm going to go next in the near term, and I'm really excited about that because it would mean kind of significant, an order of magnitude more than what I'm doing now. So that's really exciting. And then more in the long term, and I'm kind of always thinking about other opportunities. The startup that I mentioned that I'm going to be working with, they're working on a software platform for particularly aimed at primary care docs. So I'm really excited to help get that up and running, kind of in the near to medium term. And I think because it's going to be able to help docs provide much higher quality, more cost-effective care, and it's a little bit like kind of an EMR on steroids without the clunkiness. It kind of overlays onto an EMR and then has a really nice graphical interface that makes it much easier to make sure that patients have done all of their recommended screenings and preventative health maintenance types of things, as well as care coordination, and then making sure that the provider is accurately capturing kind of all the diagnoses and just how complex and or sick a patient might be. So I'm really excited about getting that up and running, because I think it could be the basis for what many systems use to kind of, like you were talking about, more focus on care delivery and efficient, user-friendly care delivery, as opposed to most of the software platforms we have now, the EMRs that really just leave a lot to be desired for the most part. So that's kind of the near term and near to medium term. And for me, the long term and has stayed pretty similar to kind of what it's been for some time. Actually, I'm very interested in going into government, either through elected office or as someone else's healthcare advisor. So once I can get all my med school loans paid off and have enough of that leadership responsibility under my belt that I mentioned, and the time feels right for me and my family, that's kind of where I envision going ultimately, because a big part of the reason I wanted to get the MBA is that I feel that for too long, people trained in clinical medicine, both providers and others on the care team, kind of left healthcare to business people, and I think it's incumbent upon people with clinical backgrounds to get the training necessary to efficiently and in a high value way operate a healthcare system. So for me, that meant getting an MBA, and then I think we need people with those backgrounds, both on the private side, in companies where I think there are more of those people, but then I think we also need those people to go and work publicly as well too. So that's why I plan on eventually going there to the public sector.
Okay. So one of the things, Noah, that I see going on right now is that there are a significant number of family physicians who are becoming CEOs of health systems.
Mm-hmm.
And I think that's a good thing. I think that the business people, the MBAs who are running healthcare systems, they really don't understand the nature of the business that they're in my opinion. And the bureaucracies that they have created and they try to manage are very clunky, to say the least, along with the EMRs. So family docs, whether it's Christiana Care in Delaware or CHI out in Nebraska or a number of places, there are family physicians who've moved into those leadership roles. And I think that's a good thing. And by the way, if you'd ever like to talk to any of those people, just send me an email, say I'm ready to talk to, people at the higher levels, get their perspective on, family physicians as leaders of systems.
Yeah, thank you. I appreciate that. That's definitely something I think I will take you up on in the future, and hopefully not too far away from that soon.
Yeah, I suspect not. So just let me know when you're ready, and I can set that up. And I guess my final question for you, Noah, is you're still a relatively young leader. As you would be making recommendations to medical students or to residents or to people who are just straight out in practice, what are your recommendations in terms of how they should develop themselves as leaders?
Yeah, that's a great question. So I think the first one is, and you can say it so many different ways, but it's to find their passion, find their true north, because that's got so many core and fringe benefits too. I mean, the core is clear. It keeps people passionate about the work they're doing, and it makes it frankly not feel like work. So when I have med students working with me, I tell them, when I ask if they know what kind of medicine they're interested in, I tell them that they absolutely don't have to say family medicine, they don't have to say hospital medicine, because to me the most important thing is just that people are pursuing the type of medicine that they're passionate about, because that's going to make them, treat the most number of patients for the longest time and be the most satisfied doing it. So that's the first piece of advice that I give, and that really and that came from another mentor at UMass, Frank Domino. He was after Stacy, he was probably the second most influential person for me in terms of going into family medicine, because and I attended he holds a dinner for people interested in family medicine every year, maybe even a couple of times a year, and I just happened to attend on a whim with my roommate and his girlfriend at the time, now wife, who are both UMass med students, and I went there, kind of maybe thinking about family medicine, but I remember him saying something to the effect of that it didn't matter to him if we went into family medicine, just as long as we went into what we loved, and that was really neat for me to hear, and I think was the other piece, of feeling like family doctors were my people. Like I mentioned, that experience with Stacy showed me, because that really it really showed me this kind of non-judgmental, happy for others and wanting to help others kind of create wins for themselves, and just seeing the value in that about family doctors, that was really that again made me feel like family docs are my people, because especially in the primary care setting and even inpatient to some extent, that is so much of what we do, trying to motivate people to lead healthier lives, even just when we, trying to get them to take a medication when we prescribe it, when we don't, if it's just lifestyle change, the importance of motivating people, and being able to do that well has been a real game changer for me, and because it has been for my patients, helping them feel that they're supported and believed in, and just genuinely being in that moment with them, if it's happy when they've lost a bunch of weight, or got their diabetes under control for the first time, and then even if it's not or if it's a more challenging moment, still kind of being able to be there with them, and and support them, and then if possible kind of help dig them out. So I realized that non-judgmental, wanting to create wins for others was kind of the kind of doctor I wanted to be. So I've always encouraged other people in their training and learners to pursue what they're most passionate about. And then probably the second one is the importance of being surrounded by a great team. I've always felt that a big part of where I've been able to get to in my life certainly has to do with my own hard work, but has a lot to do with the support that I've received from people all along the way, from my family members, to great teachers that I've had, even not so great teachers. I'm a really big believer that if you only learn from good experiences, then you're missing out on probably even more than 50% of our experiences. And I try and learn, from failures, both my own directly and any that I perceive on the part of people around me too, to just try and learn as much as possible. So, I'm a really, really big believer in trying to surround oneself with the best team possible, and that everything all the success that we have ultimately goes back to that. And then probably the next one, it may not seem as even in my own life kind of hasn't maybe seemed as inspirational as the first two, but is the importance of organization. I think maybe Stacy taught me this, and she might laugh to hear it, but I realized in interacting with some people in my life, that you can that you can seem like Superman or Superwoman if you can kind of keep things organized, even though you might not feel like that at all. So, in her case, having a large family like she does, and doing having a leadership responsibilities that she does, and then being an amazing marathoner the way she is. I really tried to model myself after people like her, and realize that a big part of that is just being able to stay organized about things. I see so many senior leaders, all the time walk into meetings, not take any notes, be pretty bad with email follow-up. And I realized that it seems so simple, but just being able to be organized and kind of keep track of things is one of the qualities that can really separate highly effective people from people who are just kind of puttering along, and not to say that not to be judgmental about it, to each their own, but just that realizing for myself kind of where I wanted to be and how to get there, that was one of the things that was gonna help me do that. So the importance of organization is definitely a big thing. And I guess I would say those are probably my top three. I could probably continue on with some other things, but I think those are probably I take for granted hard work. Actually, that's funny. That's kind of all throughout there. That's
right.
the foundation of all of those. And it's funny that I don't even think to mention it explicitly, because to me it's because of some of the things that I talked about at the talk I gave at the FMEC, I feel very lucky to have the opportunities I do, and I feel like because of that luck, that privilege, that it's incumbent upon me to work as hard as I'm able to, for as long as I'm able to, in the service of the people around me and my community. And that's just kind of the social contract, so to speak, that I've made because of the opportunities I feel privileged to have.